16 postgraduate medical entrance exam. Wonderful result, Dr. Souvik. Congratulations to you on your success. Kindly share with us, how are you feeling?
Thank you very much. I'm feeling happy, I guess. On top of the world, of course, I've cleared AIIMS and PGI. They are supposed to be the two toughest exams. So, of course, I'm happy.
Of course, and we are much happy to have you here with us, a Damsonian with a sparkling result. First and foremost, the thing comes to our mind is that how did you prepare for such a tough exam? But before that, I am sure that my viewers are dying to find out something more about yourself. So kindly tell us something more about yourself.
Okay, so I'm Souvik Dey. I have done my MBBS from Guwahati Medical College, Guwahati. So I joined DAMS when I was in 6M. So as a pre-foundation student of DAMS. And I started my preparation right from 6th semester only. So back then I used to cover like 3-4 subjects a year, so that like a base has been built on which I can revise during the last 1 year before exam. And then after finishing all those 19 exams during last year, so it was more about revision, because revision is the key, I feel. If you do not revise which you have read before, it's no use. You'll forget on the day of the exam and it won't be of any use. So that's what.
Well, that's very candidly answered by Dr. Souvik here. Another thing that comes to our mind, Dr. Souvik, is regarding the time management, because time is always, a scarce resource when you are preparing for tough exams like postgraduate medical entrance. So, how did you manage your time?
Of course, time management is the main issue. I feel time is the limiting factor, because before the exam in 1 month you have to revise the entire course. So if you do not manage your time beforehand, then you won't be able to finish your course in a way that you can revise it in 1 month. So whenever you are preparing, you should always keep that at the back of your mind. You have to read it so well that in 1 month before the exam you can revise the entire syllabus. It's a very difficult thing to do. It might seem simple, but when you do it, you will realize it's very difficult. So whenever you get any time, for example, even during my internship, which was quite hectic actually, even then whenever I found time, like 3-4 hours, I used to study, because I knew that it might not be much help this year, but next year it will help me, and it did. So my advice would be, do not waste any time. Whenever you find any time, be it during an internship, final year, or even before that, always try to use it to read something, because at the end it helps, always helps.
Well, that's very nicely answered, and what I can gather here is that whatever time you are left with in the day, you should utilize it in consolidating yourself. Well, that's very nice here. And another question that we are very much want an answer from you is that how was DAMS useful in your preparation?
It was very useful actually. If I'm being really honest, if had I not joined DAMS, I probably wouldn't have cleared AIIMS and PGI. Almost sure of that. It played a really big role.
How big? Can you just elaborate a little?
Basically, I read DAMS notes for all the subjects. My base for every subject was DAMS notes only. So I didn't read too many standard textbooks. They were used only as a reference. Like I didn't read Robbins or Harrison's. So I just read DAMS notes. They are so nice that the teachers, whatever they give, that is entirely from Robbins and Harrison's and other standard textbooks which are important. So notes, I feel, is the most important thing. I read from DAMS notes only, and then bits and pieces, like some things that were not there in the notes, that one I read from other books, but basis was found by the DAMS notes. Then other things of DAMS, of course, DBT, CBT, those things also help. Test series.
Now that we mentioned about the CBT, let me just ask you, how is your feedback on the CBT that we conduct?
CBT is, I think, is very helpful, because the marking system that is used in NV in like NEET exam, same system is used even in CBT. Also, the number of students who appear is quite high. 25,000 I think appeared this year. So you can get an approximation of where you stand. For example, I got 103 rank in CBT, so I knew I would be around 100ish or plus minus 50, and in both the exams I got similar kind of rank. So plus also the questions that they ask are those questions which has a big predictive value. A lot of questions came in NEET as well as in AIIMS from CBT. quite a few came actually. So it is my advice would be attend, give the exam if possible.
That's very nice advice that you're giving to our viewers here. And let me remind my viewers once again that I'm talking to Dr. Souvik Dey, rank 56, AIIMS November 2016 postgraduate medical entrance exam. And not just that, a rank of 64 in PGI November 2016 postgraduate medical entrance exam. Taking our conversation to the next level, let me ask you about the DVT, and let me also tell my viewers here that DAMS is the only institute that conducts and a function called DVT every year in the Tal Katora Stadium. And this year in 2016 we have entered the record books with the maximum number of doctors taking part in that exercise that we do, which we call as DVT. We have entered the record books successfully, and all credit goes to the DAMS faculty as well as the doctors and the students who were part of it. I come back to my question here, Dr. Souvik. What was your feedback on the DVT that we conduct?
It was really helpful because first of all, during those 3 days they revise the entire syllabus basically. So even if pictures don't come straight from that, but the revision that they revise in 3 days, that is very helpful. Plus this time a lot of questions came from DVT, from things which were taught in DVT in AIIMS, NEET as well as in JIPMER also. For example, in AIIMS surgery, a lot of questions as well as medicine came from what the topics which are taught in DVT only. And then again in NEET this time a lot of images came from radiology, which are very helpful. I mean, attending sir's class was really helpful there also.
So can I infer that in the light of the fact that the NEET exam for PG medical entrance has become changed overall into image based questions, such sessions are going to be useful for the students?
Definitely. Around 30 questions in my session came from were picture based only. So that's 10% of the questions are picture based. So if you're not good there, then I mean you won't get a good rank. It's difficult.
Well, those are very nice inputs and very candidly put here by Dr. Souvik Dey. Dr. Souvik, as we were talking before this interview also about the publications by DAMS, with that I refer to the CRS we have and the Last Look series and the Harrison's Notebook. Can I get a fair opinion from you on this?
I think I read the Harrison's second edition, 19th edition, second edition. That was quite helpful. It's a very good book. Basically, for someone like me who haven't read Harrison, it is a really helpful book because all the important things that are there, which might come as a one-liner, are put in a very concise manner in this book. So that was very helpful. Even the last looks are very helpful. For example, most commons they are given in one place. These things are very important for NEET. A lot of most commons come in NEET, and the CRS is also quite helpful.
Well, that's very nice of you sharing all that information with us. Dr. Souvik, as you have mentioned that you were a pre-foundation year student, with DAMS in the DAMS curriculum, I can definitely say that you spent a lot of time with DAMS in your medical school as well as, taking your prof exams, plus side by side preparing yourself for the exam like postgraduate medical entrance. So what difference do you feel in yourself in the entire time that you've spent with DAMS, right from the day of joining DAMS, then taking your profs and mingling with the faculties, asking them questions, till the day you took the actual exam? What difference do you feel?
A lot actually. Before joining DAMS, I didn't have much of an idea actually what are to be read for entrance, which are the important topics in different subjects. When you go and attend classes, they tell you like these are the important things, these are the things you must read. So when you attend classes, you know what to read, and then you also get a feel of the competition when you give tests, like grand tests. Whenever you give grand tests, there are like 8,000 students who appear in grand tests, even more I feel. So you will get a sense of the competition that is there at the all India level. So it's, and also when you get good marks, you get confidence. So obviously it helped a lot.
So now that you've mentioned about the grand test, let me ask you here about the entire evaluation system that we have at DAMS. With that, I'm referring to the subject-wise tests, the grand tests, and the mock tests that we periodically conduct. Can you just put some more light on that?
I used to give all the grand tests every month because I used to use it as a scale to measure how much improvement I've made in 1 month. For example, suppose in January I got 210 corrects out of 300, then I tried to keep, when the February I give the exam, it's 215, if it 220, so the curve always is upwards. So I used to give every month, and it helped actually, it helped a lot. Suppose you are not your score is not improving, you know something is wrong, then you can take help from the teachers also. You can ask them, they are very helpful, they will help you. So it's for course correction is very good.
So what I can gather is just that it has helped you. It has worked, in fact, as a personal litmus test for you.
Yes, definitely.
That's very nice to know. And as we all know that DAMS is quite active on the Facebook. We have a DAMS exclusive club, and also we have the DAMS cloud. How did you find it?
Yeah, it's good. DAMS, in fact, DAMS exclusive club is very important, because whatever things that the teacher doesn't teach in class, for example, the teacher can't finish everything in 2 days. Some things will be left behind. So they will give those as updates in the club. So you have to follow those updates. You edit to your notes, then you will have a very good note. Everything will come from that note only if you do that. So that is something I used to do. And the cloud is also very helpful. You get a lot of videos from like grand tests. Suppose you have attempted a grand test. Now you can go and look at the video where they discuss the questions of the grand test. You will know what mistakes you have made. You will also know a couple of extra things from the topics which you have already read, but you didn't know those things. So it will overall help you.
So that makes it a complete package.
Yes.
If you miss something in the class, then you get to find it in the DAMS cloud. Plus, the DAMS Facebook club is there to clear your doubts on the controversial questions or something which is more confusing. That's very nice of you. And let me remind my viewers once again, it's a pleasure here at the DAMS studio. I'm talking to Dr. Souvik Dey, Rank-56, AIIMS November 2016 postgraduate medical entrance exam, and rank-64 in PGI November 2016 postgraduate medical entrance exam. Dr. Souvik, just do share with us that which faculties and DAMS influenced you most.
Of course, Sumer sir, obviously. So I've always followed him. He gives very good advice actually. When I was in 6th semester, I used to listen keenly what he says, and I used to follow accordingly. For example, in 6th sem he said ki you have to read the first few chapters of Robbins. I didn't read Robbins in 5th sem honestly, but he said ki first few chapters are very important, do not leave it. So I went home and read those chapters, and it has helped a lot. Most of the questions of pathology comes from those chapters only, and other such little advice which he used to give, I used to follow it diligently, and I think that has helped a lot. Apart from that, I think Sachin sir, I have to say, obviously he has taken a special interest in me. So he's always helped me whenever I needed something, and advice, anything. I always used to approach him. Then Arvind sir also. Then Deepthi ma'am. All the faculty are very good actually.
Well, thank you very much for your kind words here. And let me just ask you here, then, which branch have you decided upon to opt, or are you taking your time?
I'm taking my time actually. See what I'll get, then I'll decide.
Oh, we wish you all the best for that, and I'm sure that you're going to choose a branch which is of your interest, and we wish you all the best for that.
Thank you.
Before we wind up this conversation, let me ask you, any message do you want to give to your juniors?
Yes, I think competition is very tough now, so it's never too early to begin. So even if you are in 4th semester or 5th semester, I think it should start preparation from there only. You can join DAMS, read the notes, and most important thing is that revision. You have to read everything in such a way that you can revise the thing, entire syllabus in 1 month before the exam. If you can't do that, you'll lose 1 year.
And Dr. Souvik, can you just tell your feeling about the fact that you were a part of DAMS Guwahati, which is quite distant, on the Indian map. So did you find yourself, what did that fact that you were distant make any difference in your preparation?
No. Actually, it worked to my advantage only, because I could stay at my home. Plus, the people there in DAMS Guwahati, they are amazing. They always went out of their way to help me. Whatever I needed, I just had to ask them. They always provided whatever I needed. So I got that personal attention that you won't get probably in here in Delhi. So I think it's not a problem. You get everything there. You get classes there. You get club. You get the cloud, CBT, DVT, TND. You get everything there. I mean, I don't think it's a disadvantage. Not at all.
Well, thank you very much for your kind inputs and your kind words for us, as well as some encouraging words, useful information that you have given in the interview. With that, we close this episode of Big Interviews at the DAMS studio. We were talking to Dr. Souvik Dey, Rank-56, AIIMS November 2016 postgraduate medical entrance exam, and rank-64 in PGI November 2016 postgraduate medical entrance exam. We wish you all the best. Thank you very much.
Thank you. Thank you.